everyone, and welcome to episode number 10 of the Prostate Cancer Patient Empowerment Podcast. I had the honor of sitting down with David Johnston, a retired environment, health, and safety professional, dedicated volunteer, and prostate cancer survivor from Toronto, Canada. Over more than half of his career, David served as a corporate director, bringing a unique perspective on leadership, resilience, and advocacy. But when David's diagnosis came during the turbulence of the COVID-19 pandemic, a time already filled with uncertainty, what followed was a fast-paced and multi-layered treatment journey: robotic prostatectomy, radiation, and hormone therapy, all while caring for his wife and brother-in-law through their own serious health crisis. Because that's how life happens, doesn't it? His story is not just one of medical treatment, but of adaptation, of role reversal, and reclaiming agency in face of unexpected challenges. In this podcast, David reflects on why he pushed for surgery right away, how the pandemic disruptions reshaped his access to care and his expectations, the emotional toll of hormone therapy, and the quiet identity shifts it brought, the power of patient mentorship, and how connecting with a fellow survivor helped him cope, and the gratitude practice that helped him navigate the darkness. Each morning, David began the day by writing down 10 things he was grateful for. No repeats allowed. This daily ritual transformed his perspective and deepened his appreciation for life's simplest things. David also speaks with honesty about the mental health dimensions of survivorship, the gaps he sees in our healthcare system, and his ongoing work as a patient advisor and research partner at UHN and the University of Toronto. This is a story of caregiving under pressure, reclaiming identity, and continuing to serve others while navigating illness. David reminds us that healing is rarely linear, but with connection, with gratitude and community, everything is possible. Welcome, everyone. David, thank you so much for agreeing to do this podcast with me. I'm so deeply grateful. So many men want to know what other people go through on this journey. So thank you so much for doing this.
Well, thank you for giving me this opportunity. It's something I really enjoy doing, is helping other people.
Thank you. And there's a story behind every diagnosis, is there not?
Yeah.
And yeah. So you have your own story. Let's start.
Oh, yeah. It's a bit long, okay, and it's a bit complicated, but I'll start off with my family history. So my maternal grandfather had prostate cancer. My father had prostate cancer, and my oldest brother was diagnosed with prostate cancer when he was 50 years old. That sort of sets the scenario for what comes up next.
50 years young. 50 years young.
Yeah.
Or so, that we call it an old man's disease. Incredible.
Yeah, but it's not. We know that, and there's so many sad stories about even men in their 40s having advanced prostate cancer. So with that, the GP I had back in 2000 did a PSA, and she was a bit concerned and sent me to a urologist, and they poked around and did biopsies and all this stuff. That was like, I was 40, and 45 actually. I forget how old I am nowadays. And anyhow, and they were like, oh yeah, you've got an enlarged prostate. That's probably what's driving this PSA. And then that GP retired, and I had a new GP, and the PSA was pretty stable. It was still hovering, around 3, which, is not low, but still. And so everybody came convinced that, oh, this is just, a large prostate. And then I went to one of these, the company I was working for back about, I think it was 2018 thereabouts. There's these companies that you go there and you spend the whole day and they poke you and prod you, and it's like, but you pay, it's a before. Right. Yeah, I don't want to say the name of the company. Anyhow. And then, your PSA is 5. Like, do you want to have it looked at? I said, well, no, my GP is aware of this and all this sort of thing. And so the following year, I saw my physician. So we're up to 2019 now. And I said to her, how about doing a PSA? And she's like, oh, no, you're fine. And she did a digital rectal exam, but you're fine. You just got a really large prostate. You're really, really big prostate. That's what it is. And then, so that was in May 2019. And then in August 2019, I saw some blood in my urine. And I remember very clearly thinking to myself, this could be serious. And, so I had that debate, am I going to be like a typical man and just ignore it and hope it goes away? Or am I going to make a doctor's appointment, which I did. And so I was sent to see a urologist at St. Mike's Hospital, downtown Toronto. And my PSA was 20. So in the space of a couple of years, it went from 5 to 20. That scared the daylights out of me. And the urologist I had was great. She, young, well-educated, up to date and everything. And I remember the discussion I had with her. I said, like, how come the doctor doesn't do a PSA test? And she said, this is a really big problem. We're expecting a tsunami of prostate cancers. And we see that starting to happen now. So anyhow, they poked me and prodded me, and they did a biopsy. They put cameras in my bladder and looked around, and they couldn't find it. And now you got to remember, this was like at the beginning of 2020, which is when the pandemic was at its height. So I was going, taking days off, going down to this hospital. It was pandemonium there. And they couldn't find anything. The biopsy came back negative, but the urologist was really smart, and she knew that Princess Margaret had this other equipment, and it's a fusion biopsy where they take an MRI and overlay it with an ultrasound, and then they got this device and they can aim the needle directly to where they see the lesion. And so we were up to September 2020, and I was originally going to retire in May, but because of COVID, they asked me to stay on because I was writing all the policies and procedures for dealing. I was the director of health and safety for Toronto Hydro. So, we couldn't shut down and tell people just stay home. People like their electricity to be on. So it was crazy. We were working crazy hours. So anyways, first day of retirement, right after Labor Day, I had the biopsy done and it was positive. That's when I discovered I had cancer. First day of retirement, right? So I was like, oh, this is not good. So then they're like, oh, what do you want? Surgery or radiation? Surgery, but you still got to talk to the radiation oncologist, blah, blah, blah. And I was like, no, you don't want to waste time. Like, let's do this. So anyhow, saw the radiation oncologist. No, I don't want to take hormone therapy. I want to get this thing out of me. And while that was going on, my wife has a recurrence of her breast cancer. So so I had a really good surgeon and urologist. He originally, I think they were going to do surgery in March or something. And he calls me up and says, we got a spot just opened up. Do you want it? And that was in December. I said, absolutely. And then we had a debate, what kind of surgery we're going to do and this whole thing. And thankfully, he is like, you'd be a really good candidate for robotic surgery. And so prior to the surgery, I was doing everything I could to get fit. I was walking every day and doing all sort of stuff. And then surgery came and it was amazing. I was in and out of the hospital in less than 24 hours because of the robotic surgery, plus, exercising, everything else. So I did that and then had the catheter and all this sort of stuff. And then I can't even remember, but around the same time, my wife went in for her surgery. I can't remember exactly, but had the catheter removed and had the follow-up, and my PSA was still 4, even though the prostate had been removed. And what had happened was, and the reason why the GP couldn't feel anything is because the lesions or the tumors had grown out of the apex, which is at the bottom of the prostate gland, and they can't be found by doing, using your finger. It's like 50%. So anyhow, I always remember my surgeon going, he says, I'm flabbergasted. I've never seen this before. I like your honesty, but it's a little bit scary for me. Anyhow, So then it was like, okay, next thing we're going to put in touch with the radiation oncologist. And also to do a PET scan. And that was originally going to be later, but they found a slot for me and put me in there. So that was advanced, and they were able to see where the tumor still was. I guess it was the clear margin, or it wasn't a clear margin. It was whatever the margin that was bigger than what they thought. My radiation oncologist scared the daylight. So he thought I had micrometastasis. So anyways, so at that point in time, they decided, okay, we're going to start radiation. That would be in April. So just a little bit more than 3 months after the surgery, and started on hormone therapy in March. So I had 33 days of radiation therapy. So driving back and forth, back and forth. The good thing about the pandemic was there was no traffic. And, but I was getting really tired. And then as that came to an end, my wife starts her radiation therapy. So we're like taking turns, surgery, then she takes her surgery. Then I did radiation, she did radiation. And then I was on hormone therapy, and they put my wife on hormone therapy. I finished hormone therapy about 2 years ago, but my wife is still on that. So that's the story of my diagnosis. It's a bit complicated. And got to remember, this was all taking place during the pandemic. And so when people tell me, that the pandemic was so stressful, I'm like, oh yeah, sure. It's like, no, you have no idea what it was like. So here I am, and things are good.
What does that do to your soul? What does that do to your mind? Where do you land with all this?
Oh, that's a very interesting question. I've been thinking about that kind of question a lot in preparation for this. I think initially when the surgeon told me, he'd never seen this before, that really scared me a lot. And I thought, I'm going to die this slow, painful death of whatever. And, that I was in that stage for a little bit, and I really didn't care about a lot of things. I didn't care about paying my income tax. I just didn't care. That lasted a while. But then I started reading and reading and reading as much as I could to say, well, what can I do for myself? And it was very clear. The two things were diet and exercise by far. And there was, at that time, the research wasn't as abundant as it is now. But, I started reading all this sort of stuff and started looking at the statistics, and as much as possible to educate myself. And, and I've always been up for a challenge. I've gone through some pretty rough times in my life and came out okay. And I thought, well, I'm going to just fight this thing as best I can. And I'm going to put all my energy into fighting it. And, and then I started realizing, I have a wife and a daughter. They don't want me to disappear. So, I have an obligation to them to do the best I can. So, and I just looked at the science and the statistics. I used to do a lot of risk management work. And I thought to myself, okay, nothing is certain, but you can tip the scales in your favor. And I said, well, I'm going to tip the scales in my favor as much as I can, And so that was where I got to, was on that. And I always remember it was one of my former employees. I met for coffee with them, and we were talking, and it was a young woman, and she said the best thing anybody ever said to me. She said, if anybody can beat this thing, it's you. And it was like, something that really, really was encouraging.
Yeah, touched me deeply. I love what you said, the restructuring and how you looked at this, that, you've been through difficult things before. You're going to go through another difficult thing, and we're going to beat this thing. I'm going to get on top of it. I'm going to find out what can I do to work alongside with the medical system to turn the boat around, and bringing to mind your wife and bringing to mind your daughter as pillars of strength, those people that actually care, they love you. You want to be there for them. You want to be the best version that you can possibly be for them.
Exactly. And yeah, so
But not
that's,
easy, but not easy. And I get that. I can read that between the line. It is, yeah, right?
yeah,
Yeah.
well, you got to go through a lot of introspection.
Yeah.
And I think the other thing that helped a lot was I remember thinking to myself was, you know what? I'm not going to let this experience be wasted. I'm going to do whatever I can to help others who have not yet been diagnosed.
Yeah.
And that was how I started getting involved with the volunteer work at UHN. And what really, really angered me at the time was they had, you know, you get all these piles of paper and leaflets and other things to read, and I read it all. And there was this thing on Kegel exercises, and it was a terrible written thing, and it was identical to what my wife received from the same hospital 30 years earlier when our daughter was born. But the part that really, I got to be careful I don't swear, but that really annoyed me was that, you know, it's like, oh yeah, do these exercises and you'll have a better orgasm. And I thought, how insensitive was somebody when they, so I wrote complaining to them. I said, you know what? Men just have had half of their reproductive organs removed. They may
Yeah.
never have an erection
Yeah.
again for the rest of their life. They'll never have an ejaculation. And you're talking about having the best organ. I was furious. So they said, would you like to be one of our patient partners? I guess because I was so outspoken. And I did get changed. They actually did cut that crap out. And since then, I've been involved with a lot of clinicians committees. Actually, I sit on them, and it's been fascinating. And what I really like is they really do appreciate the patient's point of view. And
Back in 2016, really, it happened when I started doing my survey for prostate cancer to better understand the needs of the patients. I came up with this idea, and I know that it was novel at the time. I said, what if I, every man that is kind enough to take my survey and give me a little bit of data, what if I make them all research citizens?
yeah,
They loved it. And before I knew it, I went for a meeting at CIHR and they said, we actually going to adopt your term. I said, well, I'm glad. But I think engaging patients in research and telling them that you matter. And not only do we appreciate your data and your time and your attention to answer a survey, to answer any question is so important, but it is empowering to you. It is giving back to the society. It is changing us all. We don't know how much we don't know from a patient's perspective until we know. And it is interactions. It is the type of engagement, David, that you've done that really, you might say, well, what's the big deal? I sit on a board. Oh, it's a huge deal. It's a huge deal because now all of a sudden you become that person. You become the people we're treating. You become that, all of them, right?
Yeah.
So even if you were never to open your mouth and say a word, that in itself, it's extremely powerful.
Well, you're right, because I do notice that when I'm sitting in on these meetings, the doctors and everybody is very careful about what they say because they know there's somebody in the room who's going to call their bluff if they say anything.
Exactly.
Yeah, but I get tremendous support. But I get tremendous support from some of the physicians, the surgeons. I love the surgeons the most. They really are fantastic.
I love them too. Yeah, they're incredible human beings. It took me about 2-3 years to really figure out, again, the medical system was meant to deal with a disease. And I know there's this gap that even through our research, we identify that what the patient is feeling, what the medical system has to offer, and a huge gap in between. Because there's a whole person that is, look at you. You have a wife, you have a daughter, you have a life. You just retired, but it's your life, right? So there's all that. How am I going to deal with this? How am I going to navigate? And to be able to, the work that I do is very satisfying because it bridges that gap and it brings that wisdom that you're talking about onto the clinicians who are very much interested in helping in any way they can. All the while, the focus needs to remain the same, which is the disease. They've been going through years and years, many of them more than 10, 15 years of training of how to deal with that. Now, especially now, robotic surgery. They need to focus their attention in dealing with that. They can't really, I don't think it's fair for us to have this expectation on top of it. You should know all this stuff. You should tell them. It's impossible. So I think there really needs to be a program like this that bridges the two.
You know, I have a whole different opinion of physicians in general after this experience of dealing with them, but the most enlightening one was when I was on one committee, and it was about how to give patients bad news. And most of the physicians on that committee were palliative care people, and they were really struggling with how to give patients bad news. And I was like thinking to myself at first, like, what the heck did you sign up for? It's like a firefighter who gets traumatized when they see a dead body.
Yeah.
Like, what did you expect? So yeah, it does work both ways. And I have a whole different empathy for physicians and what they go through, but also how much they really do care. And
thank you for that, David. Thank you for that. Yeah, because they do care. And they really communicate with one another. They're very compassionate. Oftentimes, God be my witness, how many times I wouldn't hear one of my colleagues, urologists, call Rob at weird times of day and saying, hey, I really have this patient. Man, I'm stuck here. What do you think of this? And what they talk with such love and such compassion and really trying to troubleshoot and come up with the best possible solution to move things forward. And all that a lot of the time is unbeknown to anybody. So it's easy to raise your finger and say the medical system, but there's this whole magical, most wonderful thing that is happening, and that is all of them working collaboratively to provide the best care possible.
Yeah, I think the real issue is with the government bureaucrats. They are out of touch with everything. So
infrastructure and training and staff, and this is something that and you're right. You are right. You're right, David. David, when did you come across PC-PEP? Tell us a little bit about that journey and
so
what is that?
So because it was the pandemic, the survivorship program at the hospital was shut down. It didn't exist except a little, like, for really, really serious stuff. But for me, and interesting, my wife seemed to have no trouble getting access, but as a man, I don't know what's going on. But anyhow, so I knew exercise was really important, and I had created my own exercise program. And if you're familiar with the Canadian Cancer Society, this thing called Cancer Connection or something, yeah. And I can't even, it's so foggy now, but I remember writing there about this exercise program I created. It meant running up and down the stair 10 times and lifting weights and doing all sorts of stuff. And then there was Dr. Trin at U of T. She runs the exercise oncology lab. She heard about me. So she said, could you come and talk to my students? And so I spent 2 hours with her graduate students talking about, because they were so fascinated, like, what motivates me to do these things. And then in the conversation with Dr. Trin, we also got talking about the lack of, support, extra. And she's told me about Wellspring. And I was like, oh, this looks interesting. So, and then it was around the same time. And I think I saw a notice on the CCS connection advertising or just mentioning the PC-PEP program.
Yeah.
I remember going, this sounds interesting. But I was already, gee whiz, at that point in time, I must have been like 2 years past my surgery. And I thought, they're not going to let me in. But I thought, what the hell, I'll register for it anyways. And I was like, so pleased, like I didn't have to jump through any hoops or anything. It's just like automatic acceptance. And it was the same at Wellspring. Meanwhile, at the hospital, to get into any kind of survivorship, you had to go to your surgeon. They had to fill out a form. And that was for every single course. And I was like, what? This is nuts. So I was going to Wellspring at the same time I was going at PC-PEP. So I'm not too sure when it all started. It was started first. But I do remember asking Rob one time, I said, I'm going to Wellspring, and there's two kinesiologists there, and they customize an exercise program. Like, I can't be doing both exercises because I'm, 2 hours a week, and they're really making me work hard. And then you want me to work on all these rubber bands and things. And I remember Rob saying, "Oh no, if you've got a kinesiologist, help me to stick with that." Yeah. So, but and that's how I became aware of it. And it was just that little notice on the Cancer Connection that CCS runs. And that's all I really remember. I don't recall seeing anything else anywhere else.
I'm so happy that you also got in touch with Wellspring and CCS. We do a lot of presentations for them. Tell me about your connection with other men in the program.
Yeah, well, so that's interesting. Again, I sort of spread myself kind of thin because one really, really good thing they had at Princess Margaret, they do have the Peer Navigator program that Movember has been basically financing. And that is probably the best thing ever, because originally the hook me up with somebody else had not gone through the same thing, because originally I just thought it was going to be surgery, but then they found somebody who had gone through exactly the same experience as me. And that was really, really helpful. And it was just somebody to talk to, but most important was speaking with him gave me hope. Here's this guy, he's doing fine. He's probably about 3 or 4 years ahead of me. But he always gave me lots of tips. And he was also chairing the local prostate cancer support group in the GTA. So I had a peer navigator at the prostate cancer support group. And then I got connected with the Warriors group, which is these men who are, on ADT for the rest of their lives, and pick their brain a bit. So then, it was sort of, and unfortunately their meetings happen on the same night and time as the PC-PEP get together. So there was that. And then I had trouble getting a mentor through PC-PEP, because I was saying I really would like to have somebody who's on ADTs, had the surgery, all that stuff. And there was one person, I can't remember his name now. I'm really terrible at remembering names. You probably know who it is, and we had some really good conversations, not every week as suggested, because he was going through a really bad time. His house had flooded, and he was trying to rebuild his rec room in his basement. And, meanwhile, he's on ADT. So it's like struggling with the fatigue and everything else. But we had a really good relationship. The other fellows, there was one guy who never answered his phone. It was the strangest thing. There was, and I'm like I said, I'm really bad with names. Was another guy. We had a great time chatting all the time, and it was really, really nice. So I've sort of I've been in touch with so many men everywhere. There's a person on the Canadian Cancer. He's one of the moderators, but him and I exchange emails from time to time, complaining about things. Like, look at this. This is terrible. Anyways. But otherwise, same thing. He's also on ADT for the rest of his life. And, but again, when you talk to other men, I think the most important thing, it gives you hope.
Mm-hmm.
And that was really important. But the other thing I have to confess is, because when I was in the program, I was on ADT, I was so tired all the time that after supper, I would fall asleep, and then I'd wake up and it's like, oh, I missed it again. So anyhow, but I get in from time to time whenever I can to do that. But it's yeah.
So I guess I need to ask you, this is very good. So you are an interesting case. You're really taking care of yourself. You're really advocating for yourself. You're out there learning about everything that could possibly help you, to empower you to best navigate this journey. And I'm really proud of you for doing this, by the way, David, so proud of you. So let me get a sense of, when did you complete the PC-PEP program? And since then, have you attended the monthly video conferences where we update the science behind the program?
Yeah, and again, I really struggle with when I finished the PC-PEP program. I think it was around March in 2023, thereabouts. And the only reason I gotta say, this is a good story about PC-PEP, because one of the things I really, really was looking for were Kegel exercises. But
Oh, that would make Rob happy.
the reason I remember March, yes, absolutely, because, Rob brought a lot of credibility to doing those instructions. I'd sat in on others and, okay, flaky people. There was one, I'm sorry, but there's a woman trying to tell men how to do Kegel exercises. The comments on that were not very good. But having Rob, that was really, really good, and it worked. And I'll tell you why, because the reason I remember March 23 is because my daughter had taken a job on the West Coast, and her and I drove a U-Haul van across North America in 4 days. And it was a great way, and I'd finished my hormone therapy that month as well. So it was like a really nice celebration. And but she had to stop to go to the washroom more than I did, just to give you an idea.
I remember that story. You wrote us an email about that story.
Yeah, I did. So that's about the time I finished it. As far as getting on, I do try to get on to those calls whenever I can. But like I said, the last year has not been great, because we're caregivers for my brother-in-law and sister-in-law, and that has really taken up a lot of our time.
It still is wonderful that, 2 years later, you're still contributing, you're still there, you're still learning alongside with all of us, because we keep updating the science behind the program. There's new stuff happening all the time, and we have to know about it.
Well, interesting you say that, because as I get more and more involved at U of T and UHN, I got invited. Now I'm going to these Ontario Health sessions, and one of the ones was to review the 5-year strategic plan, the cancer care plan for Ontario. And I got talking to one of the senior urologists from Princess Margaret, and he was, and I started telling him about, how angry I am that we don't do PSA testing regularly. And he says, I need to bring you to one of these meetings with the government, and they need to hear from you, because they're not listening to us. So yeah, I do continue to, because you know what? I don't give a damn. Nobody can fire me. It's like,
yeah.
So I'm speaking up. And yeah, but definitely I do love all the updates on the science, because I've learned so much. And if I do get this opportunity to talk, I can talk competently and knowledgeably about, why we need better care.
So tell me, David, what would you say to the soul and mind of other people listening to this or going through the prostate cancer diagnosis? What would you say to them to give them hope, to empower them, to help them along the way?
Okay, I can tell you one of the things I did for myself, because, I remember they said, I asked, the biggest fear I had was recurrence. And they told me it's about a 30% chance of recurrence. But I listened to some of those things you posted, and you start looking at how much you can reduce the risk of recurrence by diet and exercise. So you say, if it's 30%, if I can reduce that by 50%, maybe we're down to a chance of 15%. And if I can do other things, maybe I'm down to, so that was one thing. So I said, that's why you got to do the stuff. If you just sit at home, play video games, you're going to be in that 30% or worse. So that's one. The other thing I did was I started writing down the names of all the people I knew who had cancer and did not have a recurrence. And I think I'm over 40 people now who I've known who've been treated for cancer. And there's only one person who had a recurrence and passed away out of those 40. And, that's not bad and these are people who've gone.
Pretty good statistic.
It is. And these are people who've gone 10 or more years without a recurrence. In my brother's case, he's gone 25 years. He's been cancer. I do sailing. We have a club, and I talk to other guys that have been through prostate cancer. And some of those guys are, 10 years plus, and they're fine. So I think, you need to do those kinds of exercises and bring some reality to it, because the treatments have improved so much, but the research papers that talk about how effective those treatments are going to be another 10 or 20 years before we start to see, you know, I mean, all the advances in radiation treatment, we're not going to really start to see that, and probably for quite some time. And so many other treatments, and you know, so you got to keep telling yourself what you're reading. You go to Google and you read all this very depressing crap, but the thing is, that's like 20 or 30 years out of date. There's been a lot of things have changed in the last 20 or 30 years, but today's research being published doesn't reflect that. So you got to kind of tell yourself that. But I think, you know, and I have been frustrated with some other men because I keep telling them, get into PC-PEP. And they're like, oh, it's a big commitment. And I'm like, what? What the hell? Like, what is wrong? I don't say it that way, but I'm thinking, you know, what is wrong with you? This is for your own good to do these things. And you're talking about a minor investment, and it's going to pay off in so many other ways. But
thank you so much for that, David. The science is so clear, and we've been doing this work now for a good number of years. We published over 40 papers. It's unequivocally, yes, we can change the risk of your recurrence by eating better, by staying away from chemicals, which were never to be processed by our bodies to begin with. We were not meant to process chemicals. This body was not meant for that. Exercise is important. It works in tandem with what we eat. You know, thinking differently, like look at how you're thinking now. That's empowerment in a nutshell, basically. There is another way to look at this. I've been through difficult things before. I can do this. You know, so how we think about issues, how we reframe them, how we look at them, they all help this potential bodily soup in which the cancer could potentially be growing. We decrease inflammation. We have better relationship. We have a better night's sleep. We time restrictly eat. So we give our organs a chance to regenerate rather than constantly going and going and, you know, having to deal with all those chemicals and inflammation all the time. So all this is wisdom, and we can help one another. So very, very happy you're saying that. Thank you.
You're welcome.
So what's next for David?
What's next for David? That's a good question. You know, I keep getting involved with volunteer work, and I was doing a lot of volunteer work before I retired. I don't know how I did it. And when I look back, I mean, I was the director of a lot of things at Toronto Hydro, and, you know, it's, you know, keeping a city supplied with electricity is a lot more complicated than anybody would ever imagine. Things are always going wrong, you name it. But I was doing that. I had a pretty good staff, but I was also chairing two large not-for-profit boards. I think, you know, probably combined budget was over 50 million. And I was sitting on a variety of committees. I was advising the provincial coroner on, you know, workplace fatalities. It's just, you know, I look back and I think, how the heck did I manage to do all this? But do you know Dr. Matthew?
Yes.
Yes. So I was in his program. He was running a clinical trial.
Yeah.
And I always thought that has got to be the best complementary program for PC-PEP, because
totally, yeah,
you know, and if people would only provide the funding for that to continue, it would be amazing. So my coach went off on maternity leave. So Dr. Matthew became my coach. So
wow.
I was so lucky, right? So we got talking about a lot of things. And then my last session with him, I said, you know, I've been through all this crap and everything. Is there one day I'm just going to wake up and go crazy? And he was like, no. He says, if you were going to go crazy, you would have done so by now. He says, but you have a very high need to be productive.
Yeah. Oh my.
And he says, so take it back a couple of notches. Because every time I met with
David, remember the program, go for walks in the park, get a canoe, a kayak, just lay in it, look in the sky, smell the grass.
I can't. So I'm getting involved more and more volunteer. Now I'm getting involved with community.
I'm more like you. I'm not gonna, you know, I know what you mean.
But you know, but I do want to get back to sailing. I have a sailboat. I haven't sailed that for I didn't have the ability to sail it, just because of all the side effects and everything else. And I definitely want to get back to cycling. That is
Oh, nice.
because I used to ride, well, during the week I'd do 1 or 2 10K rides in the morning before going to work. And then on the weekend I'd do, 40K ride. But when I was going through this treatment, I was just like, well, I had this secret fear. 2 things. One was because of the ADT, you lose spatial cognition. And I was afraid, this is not a good thing when you're balancing on 2 wheels. But then the other thing is, when you read all the side effects, one of the things was sudden death syndrome was, and I asked my GP, I said, what is this? And she was like, ooh, look, it's like, and she didn't want to talk about it. But I thought, and then sure enough, doesn't a friend of mine, he was a professor at Ryerson, well, now called Team U, but doesn't that happen to him? He's out riding his bike and he just died. Like, it's like, oh my God, this is horrible. So,
Oh my God, it's horrible is right. Yeah. It's incredible, the side effects of this medication.
oh,
Of course, it helps reduce the testosterone reoccurrence and so on. But my goodness, the side effects are there. The
well,
side effects are there.
once upon a time, I discovered it was used to treat sexual offenders.
Oh
And,
my goodness.
and then it was determined to be a cruel and unusual punishment. So, that should be a message to anybody how bad this stuff can be. And
That's the reality of it.
well, if
That's
you
the
remember,
reality, isn't it?
you remember that famous mathematician Turing, I can't remember his first name. Yeah.
Yes.
So when they put him on
Yeah.
essentially ADT for 2 years to cure him of his sexual, he was a homosexual. So they wanted to cure him of being a homosexual, like crazy stuff like that. So, and then, shortly after he finished it, he goes out and takes his own life, which I'm pretty sure was connected to the ADT. So, but as far as the future, yeah, just, keep on doing, want to live my life and enjoy it as much as possible.
So happy to hear that. Exactly. Keep on doing, David, what you're doing and spread the love, spread the light. Any last words?
I did watch David Ashcroft, his video, and I'm thinking, I have to agree with absolutely everything he said, just absolutely everything. But there's a couple of things I guess I want to get off my chest here is, one is, we got to do something to bring back PSA screening. This baloney about it causing more harm than good. I mean, that is based on research that has an average age of 20 years or more.
Yeah.
And since 2015, so one thing I learned at the Michener Institute, in order to actually do a look at a prostate gland, you need a 3 Tesla MRI.
Yeah.
Do you know how many 3 Tesla MRIs we had in Canada before 2015? We had 1. So, there's that. We have robotic surgery now. That didn't exist, not in Canada in 2015. And there's so many other things that have come along that allow us. There's the Dr. Klotz at Sunnybrook has developed these methods to have a very scientific approach to watchful waiting. And none of this stuff was there when they said, "Oh, stop doing this stuff." And there's my friends and I, we always say it's not the PSA testing, it's, I'm going to say this, but incompetent doctors who don't know how to interpret that data correctly, because they just want a very black and white kind of test, and it's not. So we need to have MRI machines, and we need to have, well, the other thing is with this fusion biopsies, I think that's something else that's new. PET scans, I mean, all this stuff. And prostate cancer is a lot more complicated than people would like to believe. So that's one thing. The other one I want to get off that we talked about is just this whole ADT. We need to educate and make physicians aware of the side effects. And, even with my GP, when I changed GPs because I was so angry at my previous one who didn't want to do the PSA. But anyhow, so she did the usual blood tests, and she was in a bit of a panic because she thought, oh my God, I got to do all these liver function tests. And so fortunately, I brought along that Canadian Urological Association document. I said, no, read this. This will explain why my triglycerides are high, why, everything's gone crazy. And
Exactly.
she was like, oh boy, I'm ever glad you gave me that, because otherwise I was going to do this whole battery of tests. So
Yeah.
like even that book, Life on ADT,
Yeah.
I'm not a big fan of it. There's a section there, I think it's in the first chapter, basically tells you that, the pain in your joints, that's all in your head. And I remember talking to Dr. Matthew about it. He said, no, it's
Absolutely
actually
no.
a side
Yes.
effect. But I
Yeah.
kept hearing this over and over again. I went on the class and like, oh no, and nobody, we don't have that problem, and I was like, no, it's a well-recognized. So that's one. And I would, the one thing I do want to say, you just reminded me about this thing and what PC-PEP did that nobody else did. And that was this whole non-sexual intimacy that you learn. And, both my wife and I were going through a really rough time, but the PC-PEP program taught me how important it is to at least hug once a day, So every morning we have a hug, and every night we have a hug, and it's not something that would come naturally. You actually have to do this consciously. But I'm telling you, that was, I would say, the number one benefit next to the Kegel exercises. But of all the things that came out of PC-PEP, that was the best, especially for men on ADT, because it just doesn't happen by itself. You really got to work on it. And so I thank you for that.
It's a small habit that goes such a long way for
Yeah.
the rest of our lives. Yeah.
Yes. But if you understand why it works, then you're more likely to do it. And nobody else does this. So thank you for that. That probably made my life a whole lot better than it might have been.
I will share it with Rob because, of course, we incorporate the program in our own lives, and we hug too in the morning. We hug at night, and we have those. We tease each other sometimes. In the morning I get out of bed very quickly. He's like, "Where's my hug?" No, you come right back in here.
That doesn't happen. No, I'm usually up about 2 or 3 hours before my wife, but when she first wakes up, we have a good hug in the morning.
That's so good.
But non-sexual intimacy is so important.
Oh, important.
And it goes such a long, long way.
Yeah.
What else do we got here? And then the other thing I think is men need to start to volunteer. I tell you that I am so disappointed with my fellow men for not showing up, and nothing against women. They've done a fantastic job. They are there, but they're promoting women's health. And I go to these things and like I'm the only guy there. Like, what's going on? And and men's health is in such a terrible state right now.
Yeah. Oh, yeah.
With cancer, I didn't know this until I started digging into it. Like every cancer, men have much higher incidence than women, except breast cancer. But some, I think, throat and neck, it's 4 times higher. And we need to get men out there and start volunteering, start showing up at these committees and start talking and start pushing for PSA testing and ADT education and all these other things. And then there's the mental health issue, which of course is like terrible. The other thing I don't understand is, when you look at the likelihood of men of African descent developing it meets the definition of an epidemic. It's like 25% of Black men are getting prostate cancer. That's just crazy. And nobody's talking about it. Like, I don't get that,
Yeah, and it's like a circular argument because we work with some organization. We say we really want to go and, we want to give talks and, men feel uncomfortable about, examination with a finger on their butt. This is really inappropriate. And I'm like, who cares? Would you rather talk about this and save some men? or would
I
you keep it under the rug and then you have this high incidence?
my patience is very thin because all of those things sound like victim blaming. Oh, it's the
Ah,
man's fault that they
yeah.
don't go get their blood. Well, I'm telling you, I was going asking for a PSA test and I was being denied it. I was told you don't need that. And I've heard the same story from a lot of other men. They ask for a PSA test, they're, oh, no, you don't need it.
Okay.
Yeah. And, and like when I had lymphedema, there was somebody at the hospital said, and men don't usually get lymphedema. Just go to Shoppers Drug Mart and buy yourself some compression socks. And,
Oh.
it took me 6 months to get the hospital to admit I had developed lymphedema. My wife had lymphedema. She was in an instant, you know. It's so I think this crap about men this, men that is code for saying we don't want men here. Sorry, I'm pretty straightforward about this, but I got this.
I think you're absolutely right. And I'm glad that you brought that up. What an interesting, it's code for we don't want men here.
Yeah,
I think you're
it's a
dead
it's a
on.
it's a girls
Yeah.
group. Yeah.
Yeah.
So
And maybe a lot of this mentality has something to do with the state of men's health and how there's so many areas in which we still have to shed light because historically speaking, well, this is not a men's problem. Says who?
well, right.
And how many years ago? 50,
Well, I
60?
got I got very interested in reading about male toxicity, and
Uh-huh.
I think the term is greatly misunderstood. Male toxicity is what's killing men, and it's a societal problem. It's not a man's problem. It's societal because when men complain, they're basically told to go away, suck it up, buttercup. And I'm pretty sure the medical profession is guilty of that because, I'll give you an example. I had a problem a while back and I called my doctor's office and it was, I have diverticulitis and I was having this real pain, the worst I'd ever had. So I called the receptionist, told her, it says, okay, she can see in 10 days. I thought, well, this is pretty crappy. But so I finally got to see her and told her, and she said, well, the receptionist wrote down this was for follow-up. I said, no, there was no follow-up. I said, don't you guys, I was going to ask for a walk-in clinic or something. But again, I really think there's this unconscious bias that, drives people to make assumptions and decisions on behalf of men, what they need and don't need. So the other thing, now we were sitting here, there was one other thing I was hoping we might get to talk about. And I think one of the, sorry, you can chop this all up later. And
Oh, this is so good. This is so good. I'm not chopping anything out.
Anyhow, the other thing that really, really struck me, and it was right after I had the surgery, and then later, but I remember I was at home and I had this catheter stuck in me, and I knew somebody whose child was going through gender affirmation surgery. And I remember sitting going, why would anybody in their right mind want to get their penis cut off? This was like such a strange thought to me. But later, when the effects of the ADT started taking over, and I started seeing these bodily changes. Like I lost all the hair on my chest and on my belly. The hair on my legs was disappearing. My genitals were shrinking. Thank God, unlike other men, I did not grow breasts, but that's not uncommon with ADT. And, and I remember I was kind of upset my daughter when I told her this, but I said, I feel like I've lost my male identity. And, even having that loss of spatial cognition, trying to park a car, like it was something I could do easily when I had testosterone, trying to park a car straight in a parking lot. I used to, when I was going to Wellspring, I was like, what's wrong with me? I can't even park my damn car anymore. So, and that's when I realized how powerful our sexual identity is and how much it impacts us and how we deal with things in general. And you take that away and suddenly, and I thought to myself, if somebody wants gender affirming surgery, I understand the motivation behind it because there's something in their head is telling them that they're in the wrong body. But when you're in the wrong body because of medical treatment, now I knew this was going to end. So I guess that was what kept me going, was knowing that somewhere down the road, hopefully, and it did. Like, and one of the reasons I grew a beard was to affirm my male identity, because if I could,
Beautiful. Absolutely.
it's funny.
Excellent.
One of my neighbors is a doctor, and he says, "What's with the beard?" And I said, "Because I can."
Yes.
And he laughed and laughed. That was a good joke. So, anyhow.
This is so good. I so much appreciate you taking the time to. I'm glad I asked the question.
Oh, yeah.
Before we wrap it up, because I think the best part of the podcast is actually towards the end, when we actually start to talk about those issues. I think you gave us a lot to think about. I think this was a very insightful podcast. Even I'm taking a lot of things to reflect on, and perhaps change some of the things that I do in my research and look at. But David, thank you so much for your wisdom, for your care, for your love.
You're welcome. And there is one more thing. There is a great book. I haven't bought it yet. It was just published, and it's about male existentialism. And I can't remember. He studied at York, but I think he works at New York. But I read some of the preliminary bits and pieces, and then I forgot to order it because it only became available last fall. But I remember the one thing that I found really interesting was this research they'd done during the Afghan war. I don't know if you read that or not, but they asked all these soldiers, what if you had a choice, what would you rather lose, your penis or a limb? And by far, most men said they would rather lose an arm or a leg than lose their penis. And I think that's something that's not well understood by anybody, including men.
I agree.
Imagine going to a doctor or a surgeon and say, "Hey, what would you rather lose?"
Yeah, I agree. What you said about sex identity and how it becomes the context for everything that we do. And I think this is why, it's so devastating for men to go through this ADT. Basically, you go to sleep as a 57 years old man, as Ross McDonald said. You wake up as a 75-year man. And if you think that, oh, that's nothing, really stay and think about, what does that mean?
Oh, yeah.
Think about what it would mean if it happened to you. That's devastating, because normally it will take 20 years for this to unfold.
Yeah, it's just gone.
You adjust and whatever, right? But overnight, all of a sudden, who are you? Like, look at me. I need to grow a beard because I want to hang on to, good or bad, this is who I am, and I'm happy to be who I am. And there's been a whole lifetime of
I kept telling myself, if this is what it feels like to be 85, it's not terrible, but I'm not 85. It's like, and you're sort of, it's really a weird situation, because on one hand you feel you lost 5 years of your life while you're going through all this treatment. But on the other hand, if not for that, you might be dead now. So, Agreed.
So, and that's the situation. That's where we are in terms of treatment right now.
Yeah. And that's not a bad price to pay, really.
Not a bad price, especially if you learn about it. But that's I think the piece here is, don't just assume, oh, you know what, you don't need any education, you don't need any empowerment, forget all that stuff, you're going to go through it on your own. No, you don't need to go on your own. We have a lot of information that is going to make you start laughing again, become more aware as to what are the things you can do right now that are going to make you feel better. And it is that experience that's going to become the impetus of you continuing to advocate for yourself, making little changes, like David was saying, learning about intimacy, sexual and non-sexual, practical things that can really help you bloom and grow spiritually, mentally, as a man, as a human being. It's so important. Don't give up. Do not give up.
And by the way, I'm still sticking with the program. I have not eaten red meat for 5 years.
Woo-hoo!
I stopped drinking alcohol, although that's not a big part of
Oh, that's a big one. That's a hard one.
But no,
No,
and the only bothersome thing is I had like a beautiful wine cellar. I still do. I have probably about I don't know, a couple $1,000s in wine down and
Yeah.
can't
In
touch
the
it.
basement. Yeah.
And it was really good wine. Anyways, but what happened was my wife, when she went on this hormone therapy, they told her you can't be drinking alcohol.
Yeah.
So I said, well, being a good husband, I'll support you.
Oh.
And then I started reading later and I saw the risk as a carcinogen that alcohol presents is the same as asbestos. It has the same classification. That scared the daylights out of me. So no more red meat, no more
Wine.
no more alcohol.
Yes. Yeah.
Um,
And there's another reality around alcohol. I love that you're igniting this desire in me to talk more as well. I know we need to wrap things up, but there are so many chemicals that are added to alcohol. This was not the case in the past. These days, to get a bottle of wine that has no chemicals added, you need to look very carefully. It has to be an organic wine, but even organic wines have chemicals added. I mean, even this education in and of itself, the fact that, hey, I feel the way I do, and I'm increasing the risk of cancer because of all the carcinogens, because of all the stuff that goes into wine, that wasn't the case before.
Yeah,
Again, changes, but the ultra-processed foods, like 90% of all foods that we buy, it's like, have stuff in it that shouldn't be there.
So I worked in the food industry for 8 years, and I remember you told me about eating cocoa nibs. So one of our divisions made cocoa, and I couldn't ever bring myself to eat cocoa nibs because when you see them in an industrial setting, you're like, I don't think so. And I think, and if people saw how vegetable oil is made, they would probably not use it. We had other divisions that made vegetable oil. But I got to tell you this one story. I know you're running. I love to tell you stories because I know how much.
This is so good. This is so good.
One of our divisions did animal nutrition, so basically making vitamin pills for like cattle and pigs and stuff. So I remember I'd go there and I'd do these audits. I was there one time. I mean, in the early days, they used to have like tons and tons of tetracycline, like 80-pound bags of tetracycline. It was being made in Mongolia. And I was like, this was really strange. Anyhow, but believe it or not, farmers stopped using antibiotics now because the cost was so high and the hygiene on the farms has improved so much that they don't need it. But on the other thing, there's all these shells like cobalt and copper, and all these things you would find in micronutrients. But there was selenium, like tons and tons of selenium. This is going to freak you out, this story. And I think this will be I could go on. So I said, hey, Mark, he was the plant manager. I said, what's with this selenium? Why you got so much selenium? Oh, if we use that to stop the pig hearts from exploding. And I was like, what are you talking about? Anyways, in the good old days when pigs run around, they got exercise and everything, that their hearts would be strong. But nowadays, if you've ever been in a feedlot for pigs, they just have them sitting there and eating out of a trough. They don't move. They just sit there and eat, and that's all they do all day. And what they discovered is when they send these pigs for slaughter, quite a few of them would die because their hearts would rupture. Somebody discovered by feeding them selenium, it toughened up the heart muscles, so a lot less of them will die. But you can imagine why. They're totally stressed, right? But anyhow, so that was probably one of the weirdest stories I saw in the food industry.
Stories. And again, that selenium, where does it end up? In my body.
Oh, yeah.
That meat.
You need some, but I don't know.
I'm coughing. I'm sorry.
That's okay. It's okay. Anyways, so yeah, I could talk about a lot of other things, but you're right. There's like making vegetable oil. If you really want to get grossed out, go to oil extraction. It's extracted using N-hexane. It's a solvent, and and so far they claim they've found no ill health effects with N-hexane, but I'm not convinced. But that's how they wash the oil out of the oil seeds. You gotta see. So you know what? After going to the food industry, I was like, oh my God, I got all the secrets are out now. It's hard to eat.
And I think that's why it's so important to, in a way, a lot of the stuff that we talk in the program is pure motherhood stuff.
Yeah.
There are some things I'm not going to be able to change. I'm not going to be able to go to the manufacturers and tell them to stop using that stuff in extracting oil. I know I'm not going to be able to go to the butchers or the animal grow farmers and tell them stop using selenium on pigs because you don't want to, their hearts to explode. But there are some choices I can make now, right? Honest to goodness.
Yeah.
Can choose what fruits, what vegetables, and how to eat to limit the intake of those ultra-processed foods,
Right.
of those chemicals that have been, come along with the Industrial Revolution. Let's make things look in a certain way, of a certain color, of a certain taste. Let's please the consumer. And with all that came an increase in the disease progression.
Right. Yeah.
And the decrease, the disease incidence, and look where we are now. So let's empower ourselves. Let's turn the boat around. Gents, if you're there listening to this podcast, please go check out. Nothing to lose. Go on PC-PEP.org. It's a free program. Would love to see you. David, you have been wonderful. Thank you so much for volunteering to do this podcast with me. And
I love it. Yeah.
I love it too.
And this concludes episode number 10 of our podcast. For more information about PC-PEP, please visit PC-PEP.org. It is a free program for men anywhere in the world, as long as you speak English and you have access to a computer and internet. Until next time, be well and take care of yourselves.